solution focused. This presentation is with regards to solution focused brief therapy. So in this presentation, the topics are introduction, what and why, the benefits of solution focused, the stages of solution building, not knowing, and we'll be talking about the techniques, and lastly, the feedback in solution focused. Before we start on the main solution focus, let's talk about the history. So solution focused brief therapy, the acronym is SFBT. It was developed by Steve D. Schreiser and Insoo Kimball during the 1980s. They believed that when there was an attempted solution, rather than solving the problem itself, uh, they also found out that the understanding of the origins of the problem is not always necessary when getting out of it to solving the finding the solution. They also noticed that clients would often speak about the problems and issues and unable to notice their own inner resources while overcoming problems and focus towards the future. Hence, finding that when the clients actually focus on solution itself helps the clients to actually to get out of their problem. So rather than focusing on the problem itself. So this is the brief history how SFBT was developed. So what is SFBT? It is a goal-directed and collaborative approach for change through the client's response. It focuses on constructing solutions rather than the problems. So SFBT actively works towards the solution, identify with the clients what they do well. It encourages them to use their strengths to reach their goals. Right. So usually it is short term, and let's say that it's probably like up to 8 sessions, right? So one of the biggest advantage of SFBT is that clients actually focus on their strengths solely and improve their strength and resource, although it might not be visible initially. And using that, they are able to find out solutions which they may not have thought of and work collaboratively with the therapist to find out what they can actually do to help themselves out of this problem. In my past experience, I find that SFBT actually benefits on the following. For example, addiction, behavioral problems, especially for teenagers, experiencing difficult life transition, relationships issues, or struggling with work issues. SFBT is also used in many other areas such as anxiety, depressions, and many coaches actually uses SFBT. How do we go about building the solution? These are the few stages. There are 5 in fact. First, describing the problem. So initially, we'll ask the client what can be useful for them and the problem details. We do not talk about the possible causes of the problems. We pay attention to their problem talk and then initiate the solution talk, which is the next step. So the second step is where we develop goals. And these goals will be well defined and well formed. For example, what will be different in their lives when their problems are solved? Number 3, we explore the expectations. We ask when the problems are not happening or less severe. We also ask what we need to do or what they need to do to make the exceptions happen. Right? And these steps itself substitute for intervention planning. It is like a narrative, right? It's a talk therapy where it substitutes the intervention planning. So this helps the clients to seek out for solution and erases their hopes that they actually had the solution in the past, although it is not visible initially. Number 4, towards the end of the session, we give feedback. So usually we construct messages for our clients that might include some suggestions. We compliment what they are already doing that is useful for solving their problems. We focus on what the clients, given their frames of reference, to do more of and do differently in order to enhance their chances of success in meeting their goals. And lastly, we evaluate their progress. We regularly evaluate with them how they are doing in reaching solutions satisfactory to them. We can do so by doing example like scaling question. We can ask clients to rate their progress on the scale of 0 to 10. Once progress has been done, we work with clients what work need to be done further. If problems are adequately solved, then we discuss with them whether they are ready to terminate the services. Now, an important part is that the clients have autonomy to select what they want to work on and whether they want to terminate the services. Not knowing. I find that the not knowing in SFBT is one of the most fundamental and the most important. The therapist assumes that he is not an expert in the client's issues and the client knows what is best for himself or herself. Like what Insu said, the not knowing position entails a general attitude in which the therapist's actions communicate an abundant, genuine curiosity. That is, the therapist's actions and attitudes express a need to know more about what has been said, rather convey preconceived opinions and expectation about the client problem or what must be changed. The therapist therefore positions himself or herself in such a way as to always be in a state of being informed by the client. This leads to another point, curiosity. Insu further states that curiosity leads to exploration and invention of alternative views and moves, and different moves and views breed curiosity. He or she, who is a poor observer, does not notice that a stimulating conversation between two persons can create a condition which each other's thoughts that he or she would not be able to produce by himself or herself in a different company. So henceforth, not knowing is one attribute is being genuine curious. And we keep on probing about the states, their worldview, their thoughts. Right? We want to find out more what they are in rather than we assume what we know about their worldview. And we always focus on the content that the client brings and process. And in here, because of the curiosity, the client the client tends to explore more, and this increase reflection by them without the early closure of the topic. So we get more and more details, smaller details, and the client may discover something that was their past success. The therapist maintain a position of not knowing, aiming to generate reflective process about the internal state of the client from gathering more factual information, for example, using method of Socratic questionings. This method actually encourage clients to talk more, explore his thoughts and behaviors. So what are the skills of not knowing position? Number one, active listening. The therapist can show one who is active listening by example, open questions, reflecting thoughts and behaviors or feelings even, summarizing what was being discussed in the session, and paraphrasing what was actually being mentioned by the clients. So the client will actually felt that he or she has been listened to, and at least the therapist get the facts right, and there's some accuracy in the perceived world of the client by the therapist. Observing our own non-verbal behavior. This is important because it actually shows our curiosity in the client issues that we are very keen in their issues. So example, the tone of our voice matches the client's voice. We need to maintain eye contact. Another important part is the occasional head nodding to show that the therapist is tracking what the client is saying. The facial expression in response to what the client said is also crucial. And of course, we should be smiling at appropriate points to demonstrate warmth and understanding. And there may be occasional hand gesturing, and we need to sit at sufficient close physical proximity to the client. In terms of speech, there needs to be a moderate rate of speech in accordance following with the client's rate of speech. And another way that is also important is that we lean slightly toward the client to indicate our interest and we are actually focusing on the conversation. So these are some of the important nonverbal behavior that we need to be aware of. Of course, being aware of our nonverbal behavior, we also need to notice our client's nonverbal behavior. Example, we need to observe their facial expressions, gestures, their tone of voice, and whether they are actually making eye contact with us, and whether their nonverbal behaviors convey any meanings, such as smiling, rolling eyes, looking in space, crossing legs, arms, or even a change of tone in their voice. And in many cases, where there might be actually multicultural in your organization or community, we need to be culture sensitive as different culture influence nonverbal patterns. Number four, complementing. We need to affirm the client's quality, struggles, and hard work. So by coming down to the session, the client is actually very courageable, and it takes a lot of hard work sometimes to talk to a strangers. So it is good to actually to compliment that effort and acknowledge it. Our compliment should be relative based, and it's not because we are motivated to be kind to the clients. It should be relative and realistic. And compliment can be a direct or indirect. Number five, affirming to the client's perception. We need to understand and affirm to the client's perception rather than dismissing their perception. Empathy. It is important to feel moved by what the clients say and by what they share with their worldviews and their problems and potential solutions. We need to be within the client's inner world and stay with them. And one of the most important are the positive regards, non-possessive warmth, and accurate empathy, congruence on genuineness. These qualities are really important that the client feels that there is a sense of empathy coming from us. Normalizing. So normalizing involves responding to problem thought by wondering with clients whether their difficulties are not within the range of ordinary problems of living. It is meant to counter a tendency to see a deep-seated problems and personal pathology in life's expected challenge. Right? It must be done naturally and confidently, or else the clients may feel that the therapist is minimizing their struggles. An example of normalizing is like when you hear a client talking about their teenagers issues. We could make something like a statement like, well, this seems to be a common issues among many teenagers. Right? So it is something that can be brought up to the clients that, well, these problems, though it may be unique to you, but this happens in a lot of places too. So this is a form of normalizing. Number 8, returning focus to the client. And in here, it is important that we encourage client to shift the focus from external, such as blaming someone else, like their children's, friends, spouse, or co-workers. We shift it back to themselves. It is, however, important to respect their perception because they represent how they view this part of their lives at the time they are speaking. But we also need to shift from a sense of powerlessness to a sense of empowerment. When we shift it back from the external to the internal, we are actually empowering them. Some of the questions that we can ask the clients to shift their focus, examples, what tells you that your children can be more helpful? Or what things are going better? What will happen differently? What will others notice you are doing differently? Or what is it going to take to make things even a little bit better? Or we could even ask in a word related like, suppose your boss were here and I asked him what you could do differently to make it just a little easier for him not to talk down to you. What do you think he would say? Or even this, like, what gives you hope that this problem can be solved? Like, another one is that are there times already in your life that are like this, that this miracle you are describing? And to expand on the miracle question, we can ask the miracle questions like this. to focus back to their own internal resource. Like, suppose a miracle happened tonight while you're sleeping, and the problem you're talking about solved by tomorrow morning. Assume that you don't know the miracle had happened because you were asleep. What is the first thing you would notice that would tell you things were better? What would others notice about you that would tell them you were doing better? So, this group of phrases are the miracle questions that we can actually use to help the client to focus back from the external to the internal so that they can seek out the resource, the exceptions. And moving on, noticing hints of possibilities. We find out whether there are any differences of past successes, example. We need to be alert to what the client wants to suggest or wants something different, or what maybe they might want in certain different situations, example. Through careful listening, we will be able to find many hints of possibility. An important tip is it is important not to get caught up with the client's past problem. Although we should respect their perceptions, we should try to encourage them to talk more about their solutions rather than their problems. Number 10, exploring meanings. Clients often wonder the meanings of events in their life and ask therapists about their thoughts on these meanings. We do not interpret their experience for them. In fact, it is important to ask them to construct their own meaning. Like, we can ask them if something they did in the past or are contemplating doing in the future might be useful or helpful in finding this meaning. Another way is to ask the client, what difference has this treatment made in your life? So these are the two things that we can ask them, right? So something like this, that example, suppose you decide to talk to your boss this way. What do you think will be different between you and him? So this encourages the client to think about it and to think deeper. We can also ask for interactional meanings, such as, suppose you decide to talk to your wife about washing the dish, right? What do you think may be different between you and her or you and him? So this is talking about relationships, and usually when exploring about relationships, this sometimes tends to be helpful for the clients to think deeper. And of course, relationships. Relationships are very important to most clients. I've not found out any clients that do not consider relationships as not unimportant. So we invite them to construct descriptions of interactional events as well as their meanings. And we find out who is the significant others. We can ask this question directly. Who knows you well? We invite clients to construct in interactional terms by asking, suppose you were no longer losing temper with your daughter and yelling. What would she notice you doing instead? So this will get the client thinking a lot about their relationships and also find out what are the potential solutions and even their past success. Even they might not be thinking about their past success, we can actually bring it to the future, that this may also happen in the future. And number 12, amplifying solutions. And in this part, we provide conversation in engaging conversations, engaging thoughts about building solutions. We can invite clients to talk about what happened when their problems is being solved and how life is would be very different. And we get them to amplify their solutions and their success. And this will raise their hopes and may shift their perspective. In SFBT, there are a few techniques that many practitioners use. These three techniques on these slides are the most common, although there are some other techniques. So they are the miracle question, exception question, and the scaling questions. I'll go through in detail for each of them. So what is the miracle questions? So the miracle questions is to help the clients to formulate goals, right? Is to help them to set a well-formed goals, right? It is when there is an absence of problems, or problems have disappeared, and desirable behavior appeared. And we start to have interactional terms such as how others see a difference in the clients when this miracle happens. There is a beginning steps rather than the final result. It is like a journey rather than a destination. A miracle question is where there's a recognition in which the client plays an important role for themselves in finding solution. This is where they take responsibility for their solutions. And these solutions tends to be concrete, behaviorable, and measurable. It has to be realistic. Example, this example when the client mentioned that, well, I've got to win lottery the first prize every week. This is not realistic, and we need to find out more. What does this means, and what is realistic and what is not realistic? And the miracle question actually places challenges to the client. We will challenge them to find a solution. And this means that the client will need to take lots of hard work. This is not where the practitioner, the therapist, actually put in hard work for the client. This is where we encourage them to go details in finding bits and pieces, more details of tiny success, tiny bits of solutions for themselves. So how miracle questions is being asked? First, we speak slowly and gently in a soft voice to give the client time to shift from problem focus to a solution focus. We mark the beginning of the solution building process clearly and dramatically by introducing the miracle question as unusual or strange. We use frequent pause. We allow the client time to absorb the question and process the experience through its different parts. Because the questions ask for description for the future, we tend to use future directed words like what will be different, what will be the signs of the miracle. When it's come to probing and asking follow-up questions, we frequently repeat the phrase, a miracle happens, and the problem that brought you here is solved. This emphasis is used in order to reinforce the transition to solution talk. When the client lapses back into problem talk, we gently refocus their attention on what will be different in their lives when the miracle happens. And so, this is something like the miracle question that you saw on the slides. Now, the exception question. The exceptions questions are used to uncover exceptions to current problem in client's life. It encourages them to seek solution from past success in similar problems. It allows therapists to discover clients' previous success and amplify their strengths. Once you ask for exception, you should always ask for details of the exception. Pay close attention to the ways in which the exception was different from the problem times. The exceptions can be deliberate or random exceptions, and we need to distinguish them. And of course, we keep on focusing on their strengths. It is important to respect the client's frame of reference. We still need to treat the client as expert when we ask them questions to learn more about their worldview and encourage them to seek past success. So this is one of the questions in the slides how we actually ask. There can be many ways of asking an exception questions. When there is a similar problems and how they overcome even a small bit of it. The scaling questions. Scaling questions are to help the clients to express complex intuitive questions about their past experience and estimates of future possibilities. It invites them to put their observation, impressions, and predictions on a scale from 0 to 10. For example, if I say this, on a scale of 0 to 10, where 0 means no chance and 10 means every chance, what do you think the chances are that sometime next week, your spouse will do the dishes? Or we may even ask like from a scale of 0 to 10, where 0 you have absolute no peace, you're suffering anguish, and 10 means that you have absolute peace and bliss and that nothing affects you. Where are you at now? So in scaling question, we often cite a specific times in client's life. It is useful as it is more concrete and accessible to both the client and the therapist. And it is flexible. We can use it to assess the client perception of different aspects of their worldview that include self-esteem, confidence, investment of change. It can also lead to prioritization of problems to be solved, and we can also lead to pressing of change, like such as we can check on their confidence and motivation. So scaling questions in itself can be used with conjunction of other techniques. And likewise, in the three techniques, we do not need to use them in sequence. We can actually use them at different parts of the sessions together as and when we see fit, right, to elicit solution building out from the clients. Feedback. So feedbacks are also another important aspect of SFBT. So in feedback, let's say towards the end of the session, the therapist takes a 5 to 10 minutes break before giving the client's feedback. So The feedback is to formulate some helpful suggestion. It could be some helpful suggestion that can be useful for the clients. For example, this is the structure of a feedback. First, we compliments. So in the compliments, we affirm what is important to the clients, what is their past success, and their strengths. Number two, bridge. We link the initial compliments to the concluding suggestions, which is next. So the third one is the task or suggestions. So the suggestions are given in solutions or behavioral suggestions. So the structure of feedbacks actually comes in as in compliment, bridge, or and task or suggestions. So there are three in here. So what are in the suggestions? So suggestions are usually observational suggestions or behavioral suggestions. Like in behavioral suggestions, we require the client to do something or to take certain actions that we believes that might be useful in constructing solutions. So they can bring back home as a homework if they like to and observe certain behavior. Of course, there is also observational suggestions that are based on information gathered, right? That which is actually based on the client's observation after the sessions. It is also important to find out what the clients want while we are giving the suggestion. Does the client want something different or not? If this makes sense to do the behavioral steps or observational steps. This is crucial to have the client's input because we believe that the client should have an autonomy what they want to do. So example of a suggestions is like pay close attention what is happening to your life before next sessions. Or something else like this, like pay attention to how you contribute to make this happen. This is an exception questions. So we have come to the end of these presentations, and I'd like to thank you for staying with me in this presentation. If there are any questions, do drop me a message and let me know, and I'll try my best to answer. Thank you.